Hello, everyone. My name is Tom Gaze. I'm director of the Rockefeller Institute, and I'm going to shout you down. About a year ago, Richard Kirsch asked me whether the Rockefeller Institute would have room for him and a research assistant to work on a book about the passage of the Patient Protection and Affordable Care Act. I was delighted to make space for Richard. He's smart, interesting, and his take on the healthcare struggle is unique. As the former national campaign manager of Healthcare for America Now. But though I wanted Richard around, I thought I would get also a commitment from him to organize a forum at the Institute on state responses to federal reform. And he's done that today with a wonderful panel and obviously a great turnout, and it's a fantastic topic. So this rent payment is paid in full. Thank you very much. And surely one of the quietest periods in Richard's professional life, he's been an Institute Fellow at the Rockefeller Institute and a Senior Fellow at the Roosevelt Institute in recent months. Before he sat down to be a book author, Richard was National Campaign Manager of Healthcare for America Now, a coalition of over 1,000 national, state, and local pro-reform advocacy organizations that agreed on certain basic principles and worked together to help pass national legislation, especially, as the book points out, to bolster support among wavering Democrats, of whom there were quite a few. I thought it was particularly interesting, and we'll just have to have a book forum in about a month and about a year from now. It was particularly interesting how the coalition was nimble and coordinated, not only at the national level, but at the state and down to the local levels. But to learn more about that, you're going to have to read the book, which is now whittled down to a mere 425 pages. And so there is more to come. As HCAN's chief spokesperson, Richard was frequently quoted in all the major national newspapers, and he appeared on PBS's NewsHour with Jim Lehrer, CNN, ABC's World News Tonight, Good Morning America, Fox News, C-SPAN, and the Colbert Report, where he refused to make the clear choice between saving national health care reform or rescuing a little old lady. I would think that you could at least say that she would get a fair hearing at her death panel. Anyway, before his work with HCAN from 1985 to 2008, Richard served as executive director of Citizen Action of New York, a grassroots citizens organization with 20,000 members in New York State, and as executive director of the Public Policy and Education Fund of New York, a research and educational foundation affiliated with Citizen Action. Over the years, Richard has had many successes as an advocate. He led successful campaigns to expand healthcare coverage in New York, an author of New York's Managed Care Bill of Rights. He helped direct a 1998 ballot initiative to strengthen New York City's public financing of elections. He's written widely on many issues, founding co-director of New Jersey Citizen Action, and like many progressive advocates of this generation, he got to start working with Ralph Nader. His efforts have been recognized through many awards from many advocacy organizations. He's a graduate from Brown University and received an MBA from the University of Chicago. Please welcome your moderator, Richard Kirsch.
Good morning. Somebody here? Let's try that again. Good morning.
Good morning.
All right, I feel much more at home now. Thank you, Tom. That was a very gracious introduction. I didn't surprise that. I didn't expect that. I was surprised. I didn't expect that. So
sometimes I can be gracious.
It's really lovely. Yes. Well, you're always gracious. Tom was one of several readers, and he made several contributions, but one was to actually help me shorten the book. Everybody else says we love the book, we don't know how to shorten it. Tom actually helped me shorten it, which I really appreciate. A lot of people reading Atal Gawande's writing about the healthcare system. One of the observations he made was that every country's healthcare system really emerges from what was before it. It's a unique product of the system that was in place. And so that is really very much true of what Congress passed and the President signed for the Patient Protection and Affordable Care Act. It builds on our employer-based system, it builds on the public system through Medicaid, and it adds a way of organizing our current private health insurance system for individuals and regulating that to make it more accessible with government subsidies. So while it really was a very incremental change, it's still, we've seen it being incredibly highly polarized. And we, I guess, shouldn't be surprised either, because that also builds on our history of fighting about healthcare in a very polarized way. After Harry Truman got elected on trying to pass universal health care, the AMA hired a PR firm to gin up a whole big campaign against it, and they came up with a quote. They totally made this up out of thin air. They attributed it to Lenin, saying, "Socialized medicine is the keystone to the arch of the socialist state." And that concocted quote made it into newspaper editorials all around the country, and as recently as 2000 it was quoted by the president of the Association of American Physicians and Surgeons. So we saw the same thing, of course, in the last couple of years, where the very respected St. Petersburg Times political fact said that the 2009 lie of the year, not just in healthcare, but all of politics, was death panels. And the 2010 lie of the year was a government takeover of healthcare. That, of course, with 9 months of after no public option, the legislation passing. So civilized discourse has been more scant than we'd like. Some of this would be funny if the stakes really weren't so high, particularly when you look at the roots of the Affordable Care Act, really based on the plan in Massachusetts, drew a lot from the Heritage Foundation and people like Newt Gingrich and the individual mandate and the exchange as an organized marketplace of private insurance. So this really is a plan that has a lot of conservative roots, liberal roots, and is very much an American solution. One thing that I oftentimes hear from people who are strong single-payer advocates is that every other country in the world has single-payer. And I pointed that's actually not true. What every other country does have is a system, though, that treats healthcare as a public good as opposed to a commodity. And that really is the big distinction. They do that in different ways. It can be a socialized system like England, can be a public health insurance system like Canada with one payer. It can be a system like Germany where it's not run by the government, it's run by private regulated nonprofits. But in all these systems, they're basically looking at what's the government role in making healthcare a public good, not only a right, but understanding that markets don't really work for healthcare, and therefore you need to have government regulation of both the supply and demand of healthcare. And that really kind of sets the tone for today's panel, because as the ACA is implemented, there's going to be a lot of leverage to states. The federal government has taken a major step towards making healthcare a public good by saying we're setting up a system where there's the expectation that affordable health coverage should be available to everyone in the country through a combination of regulated private insurance and public insurance. And states are going to have a lot of leeway in how to do that. And of course, New York is grappling with that. And so we thought what we would do today is have a conversation with folks in New York as you're all thinking about what you're going to do with what 3 neighboring states are looking at. And I'm going to keep my introductions really brief so we can get to the panel. We're going to try to have interaction with the panel, with the audience, try to make this very interactive. We have one little problem for those of you who parked, which I'm going to tell you about. We take a brief break at 11:30, but don't worry about it now. Sit and relax. But as I said, you've got good introduction. You've got lots of buy-in from your panel. So let's start with our first panelist, who's Brian Rossman. He's the research director of Healthcare for All Massachusetts. And I think what's key about Healthcare for All is they've really been in the leadership of state efforts for comprehensive healthcare reform for now 20 some odd years. In 1988, working with Governor Dukakis in the Massachusetts legislature to pass what was then the first universal healthcare plan passed by a state. Some of it stuck, major expansions of Medicaid. Some of it was rolled back, never happened, which was an employer mandate. But then, of course, Healthcare for All played an instrumental role in the shaping of the law that Governor Romney signed in 2006, and really is the model for what the ACA is. So we're first going to hear from Brian Rossman.